You might not think an industry newsletter from Texas and New Mexico could tell us much about the entire country. But wow, it really can. We're going to dig into what's happening on the ground in hospice care, because it turns out it reveals some pretty big truths about all of us. This quote right here comes from a hospice professional, someone who's seen it all for over a decade. And their point is powerful. Dying isn't just a medical thing. It's like a mirror held up to our society, reflecting not just our successes, but maybe more importantly, our failures. So as we go through this, that's the lens we'll be looking through. Okay, so here's how we're going to break this all down. First, we'll look at the shifting rules of care. Then, we'll talk about the people on the front line. After that, we'll dive into what this all means for the patient. And finally, we'll put it all together to see the whole system in motion. All right, first up, the shifting rules of care. Because behind every single patient's experience, there's this dense, complicated web of policies and regulations that basically dictates everything. Now, I know what you're thinking. This looks super dry, right? But every single one of these lines has a massive real-world impact. I mean, when a federal contractor revises billing codes for Alzheimer's, that can completely change a family's ability to get care. And at the same time, you've got states like Texas and New Mexico constantly rewriting the rulebook. It never stops. And these rules, they're not just about billing and paperwork. They're about safety. There's a new law in Texas, for example, that forces agencies to create programs to deal with workplace violence. And that's a pretty stark reminder of the very real dangers these caregivers can face every single day. And then you see a policy change like this, which can directly improve a patient's comfort. Texas just expanded its compassionate use program to officially include hospice patients. This is a huge deal. It gives people a new way to manage chronic pain when they need it most. So, if those are the rules, who are the people actually working within them? Well, that brings us to the most human element of all, the people on the front line. We're talking about the aides, the nurses, the social workers doing this incredibly tough work. And this brings us to a really tough question, one that gets right to the heart of how we value this kind of work. Are the people providing this essential hands-on care actually being paid fairly for it? Well, that's a debate that's happening right now at the highest levels. And here's the tension in a nutshell. As it stands, hospice aides are covered by federal minimum wage and overtime laws. But there's a new proposal from the Department of Labor that could just completely wipe out those protections. As you can imagine, advocacy groups are fighting back hard, saying it would just be a devastating blow to a workforce that's already stretched so thin. So here's the paradox, right? While advocates are fighting to get caregivers paid more, the system is also being tested by a few who are trying to get paid for care they never even provided. It's a really difficult situation. And the stakes are incredibly high. We're talking more than 20 years. That's the potential prison sentence for a nurse assistant in New Mexico who was just indicted in a hospice fraud scheme. It's a shocking reminder of how vulnerable this system can be. Okay, so we've got all these shifting rules and these workforce pressures. But what does it all actually mean for the patient? This brings us to the most important part of the whole story, the patient experience. This headline from Stat News, it really hits hard, doesn't it? It points to a really painful truth. That original promise of hospice to provide dignity in death, well, it isn't being delivered equally to everyone. The system, as it's built right now, often fails the people who need it the most. And yet, in the middle of that flawed system, you find these just incredible moments of humanity. Like this story out of Texas, where a local shelter went above and beyond to find a new home for a beloved service dog after its owner had to move into hospice. It's these small, individual acts of kindness that so often fill the gaps the system leaves behind. But it's not all just individual heroics. There are signs of positive systemic change, too. We're seeing hospices expanding. There's a growing recognition that professionals like social workers are absolutely essential. It's a push to make good care less about luck and more about a reliable, standardized process. So when you put all these pieces together, what do you actually get? You get a system that is constantly changing, constantly in flux. What becomes really clear is that hospice care is this incredibly delicate balancing act. On one side, you have all the changing regulations and the immense pressures on the people doing the work. And on the other, you have this patient experience that can swing wildly from systemic failure to moments of profound, beautiful humanity. And that leaves us with the one question that really matters. As this whole system keeps evolving, as new laws get passed and new challenges pop up, How do we make sure that hospice care actually fulfills its original fundamental promise to offer dignity, comfort, and peace to everyone at the end of their life?